Thank you so much to our panel and to everybody that's here already. I know in some time zones, this is absurdly early. One of the suggestions we've had is to work on better timing for these and to vary the timing of these roundtables as we go forward. You guys are part of the very first official roundtable. We had one, speaking of soft launches or soft starts, we had one in July that was related to orders. And it went off well. It was a good proof of concept. We'll probably return to some of the workflow ones in future topics. But for today, I have several very generous folks that have recently conducted flu clinics in the time of COVID join us today to give us their impressions, explore their successes, their challenges, their tips, tricks, and words to the wise. In the interest of time, I am going to pop the introduction or the introductions generally, specifics in chat for our panelists. And I'm going to share the way that I had done this last time that worked so well is this is so much conversation that the visual that I'm going to have is just a document, a live document that I'm going to use to capture the ideas and capture the high points and make that something that we take away. So I'm basically I'm acting as moderator and note taker. So any links you guys have to share, even attendees as well, if there are things you want to pop into the chat, we are recording, so I can go back and refer to this. Don't feel like you have to slow down for me. I'll grab things and pull details in as we need to. But what we're going to do is get started with the conversation. So allow me to share the document. This is where I'm going to take our notes, and there we go. That's the one. And hopefully that is big enough. I hope if I've done this right, you're seeing the PCC orders. There's the first change. PCC flu clinic roundtable. Okay. See how this is a living document. I needed something to demonstrate it. So what we're going to do, Dr. Marconi dropped off, she just took herself off camera. So
sorry, I didn't mean to.
That's okay. No. The only reason I cared was because I need you to introduce yourself. I had written introductions for everybody, everyone but you.
Okay.
If you don't mind, this is all that I asked was just the name.
Okay.
Here for folks that don't know you, your name and these other 3 details here.
Okay, I'm Jeanne Marconi. I'm in a practice in Connecticut that has 2 locations. We have 14 clinicians. We have been with PCC too numerous to count years. I don't know how many, maybe 10. And we've been doing drive-through clinics for about 18 years.
Awesome. Thank you so much. And here I am putting in exactly those same things. If you'll say hello, Dr. Lavania, the information that just popped in there is for Dr. Lavania. And the last details here are for Dr. Matthieu. So if you guys need to know which of the beautiful faces on the screen here is in a practice that's most similar to your own practice, and if you had wanted to follow up or ask specific questions that are practice size or practice type related, you know to whom to direct your questions. But otherwise, this hour goes very, very quickly. If my experience with the Orders Roundtable is any indication, we're already a minute ahead of schedule with introductions. And what I would love for you guys to do is decide first who wants to go first. If we go alphabetically, it would be you, Dr. Lavania. And just describe what your experience with managing flu clinic has been like in this, I can't count, I've lost count of the number of times I've heard the phrase, this unprecedented time. So yes, if you would just speak to those things that we had talked about, or the food for thought, these sorts of things that went into your thinking and your experience with flu clinic.
Well, we didn't want our front desk to be inundated with phone calls about flu clinic, so we decided to make a link where everyone could do their questionnaires, get a copy of the vis sheet, and then schedule themselves online. And then we transferred that over to PCC. That worked really well for us. Everything was already taken care of. All the questionnaires were done. All we had to do day of was just ask the COVID questions. And then my front desk made sure everyone's insurance was up to date the day before. So we had everyone already scheduled, and then we made little baggies for every family. So we would count out how many of the family members got flu mist, how many had VFC versus private, and then we just put it all on a little Ziploc bag and put the needles on the vaccines and had it all ready for the next day. So it was so fast. My staff, when we were done, they said they'd rather do drive-through flu clinic every year, not just for COVID, because there was so little time required to clean the rooms. We just went to the parking spots and gave everyone shots, and none of the kids could take time to run away or spend time with their parents trying to negotiate, because the parents felt like they had to get out of the parking lot.
Wow.
So we loved it.
That is awesome. I love the baggie.
Is this your first year doing it?
This was our first year, and it's just myself and my nurse practitioner, 3 nurses and 2 front office people. So we were all there, and we had 5 families. No, we had 4 families every 15 minutes, but we could still have seen more. So we bumped it up to 5 families. We even took walk-ins, and it still worked well.
Yeah, it's pretty quick.
Yeah, it's very quick.
Hiral, a question about when you put the vaccines in the Ziplocs ahead of time. I heard you talk about that on the PMI, and I thought it was brilliant. And then when I brought it up to my associates, the first immediate negative response was, well, that seems like a lot of work. So
it's going to be a lot of work day
more work on the front end. It's more work on the front end. I figured it saves on the back end. What would you feel like was the overall time involved of doing Ziplocs versus not?
So we had about 101 patients, and it took us about, I would say, 40 minutes total to just go through, because we still had to go through every questionnaire, make sure that the people who asked for flu mist could get flu mist. They didn't have asthma or anything. So we were all just working on that together. And so as I looked through the questionnaires, I would order the vaccines and my staff would make the little baggies. Otherwise we would have spent that time on day of, which, if there's not a lot of patients, that would be easy. But if you're trying to really maximize that time, then you could save yourself a lot more than just 40 minutes on day of.
I mean, that's what it seemed like. Thank you.
Mm-hmm.
Yeah, and just think about too, if you're doing it in the office, you have, the staff person's time to go get the patient, bring them in the room. And now with all of the extra cleaning, that has to be done, and then you still have to go draw up the vaccine, you still have to do the process of getting the vaccine ready. So just adding it in a bag to me seems like a minimal amount of time, very minimal.
Mm-hmm.
What did you use for the pre-scheduling? Full Slate or?
We use Full Slate, and we've been using Full Slate for, I want to say, almost the entire time that we've been doing the drive-through, which, as I said, was like 18 years or so. So maybe like the 3rd year in, we did Full Slate. And we are now, I'm going to share, I was talking to another physician, and they actually use Full Slate. And they liked it so much that they are now using it for their walk-in appointments for 8 to 9 in the morning, which lightens up their phone at the front desk and all of that. So they're now applying it in another way, which honestly I didn't think of, and I think we're going to do the same thing to avoid, all of the phone stuff. And, they're using it as, walk-in in the office. And I'm thinking we might add a telemedicine hour from 8 to 9. And then if it's not appropriate, the provider will just, schedule them a visit later in the day. But I thought that was a great outtake, something that I hadn't thought of. And I think that's what's great about us having these discussions is, even though we've been doing it for so long, there's still more to learn and, to adjust and adapt to the situation that we're dealing with right now.
That's awesome. So is that a good segue into your findings, Dr. Marconi?
Sure. So I have been very busy over the summer. I have given the webinar on the drive-through flus to probably almost 6,000 people. in a variety of venues, whether it's large groups or private offices. And it's really amazing how easy this was for everyone to do. I mean, I'm constantly getting emails how, wow, we were so afraid. We were so, the staff were like making goo-goo eyes when we first brought it up. And the like Hiral said, like the overall impression after it was done was like, wow, this was amazing. And then the patient satisfaction, everyone seems to comment about that too, that the patients loved it, not being hassled to come into the office, regardless of whether it's COVID or not. It was just an easier event. I think all of them too, there was a great fear, and Hiral mentioned it, briefly, oh my God, we have the kid in the car. What if they're gonna like squirm? It actually was easier because they are, the kids that squirm or don't want to do it are probably still in a car seat. So for many of them, it was much easier. So I haven't heard any negative feedback, and I asked for people to please bring that back to me so that we can address it. I think there are some questions about the cold chain. And I'm not sure cold chain of drawing up 100 vaccines and keeping them temperature safe. I don't know about that, but I will, let you know that on October 15th, I'm doing a webinar along with the CDC for immunize.org. And I am going to bring up some of these questions that have come up over the last month or two related to the cold chain. And I will post that link on SOPM once I get the registration for that, because I think that might be a good one, because CDC will be right on board and able to answer some of these questions. I think if you were to put a financial value on this, and I guess I could have done the work, but I haven't. If you added up your staff and overhead dollars to figure this out, I would bet that this is probably going to be less than 25% the cost. Just because you could be seeing other visits in the practice and using those rooms. Because remember, a flu clinic takes up a lot of rooms. So, and depending when you did it. I think the other thing to mention is, you don't need to put a lot of hours out to do a schedule. You could just do 2 hours. I had a practice right back to me. They did 250 flu shots in 4 hours, which, to me was amazing. And they had two rows of cars going. So, they figured out a way to do it with one check-in person and then directed them to 2 lines. And they basically told me that it was like when you go up to the car wash, and there's like 2 lanes, kind of like the same thing. There's the check-in one guy, and then you go through the car wash. So they actually, and I had suggested doing 4 people for that, but they were able to do it with 3. Which I thought was great, 2 giving the vaccine and 1 doing the check-in. And I think the only thing added this year is, doing the COVID questions, whether, you did them ahead of time, like, as part of full slate or as part of your registration, and the person who's kind of like checking the people in. And I haven't heard anyone have to kick anybody off the line yet, but it's no different than what you can do in your office. So we kind of did it as like a checklist. We put the patient's name on it, and then after the flu clinic, we scanned it into the report. I think that's pretty much all I have to say. If anybody has a question about any of those things.
Cool. And I'm tracking questions in chat as well. Thank you, Dr. Lavania, for picking up that one in chat. In case anybody didn't see it, there was just a question of whether Dr. Lavania had used full slate as well. And intake Q, is that the way you say intake?
Yes.
Q? What do you think of that product as?
Well, we've used it for a while for registration. And so we decided to use, since we already have the system, we decided to just use it for scheduling. And so I think they charged me $5 more to do the scheduling. And it was just so easy.
Hmm.
So.
Awesome. How about you, Dr. Matthieu? What are your takeaways and your memorable experiences?
Yeah, well, I think, for good or for bad, this year has kind of forced us to do some things that we were always really hesitant to do before. I mean, not that it's been easy to do all these changes all the time, but it was kind of the kick in the pants that I think we needed, and some other people needed. So I think one thing to call out for an office that's doing it for the first time is buy-in is so critical. And so we just spent a lot of time just really going back to what are the reasons for doing it. And it fell on two values. That one, we want to get kids immunized, and we still have families that are hesitant about coming into the office. And we want to do it in a way that keeps everybody absolutely safe. And so I felt we really had no alternative but to do it outdoors. So that was good. The other big thing is it was overwhelming thinking of all the details. We stole from everybody that we could, including Dr. Marconi, all the ideas. And then I dumped it on everyone else and I went on vacation, and I highly recommend that as the best way to plan a flu clinic. And when I came back, they had it all organized. It was fantastic. So we were limited in when we can do it because we are just one office in a big office building on a hospital campus. And so we could only do it on the weekends when there are not other practices going. So we're just doing Saturdays. We just kept the way we have always done our flu clinics, where it's just call and schedule. We did set up in the portal where they can request a day and which kids they want scheduled, and then we'll just schedule it for them so you can't avoid a phone call. And we schedule them we have visit types for flu shot and flu mist. So we can kind of plan ahead. And we learned that the hard way in years past, when sometimes your shipments aren't coming in and maybe we don't have VFC flu mist, and we can just look, okay, who's coming in for flu mist? And let's see, and maybe we need to call and reschedule them till later. So that's why we do that. We always, for all of our appointments, even doctor's appointments, we have a text or email reminder that goes out, and we always also make a phone call. And we did that for this as well. Our staff called everybody to do a reminder call, and that was a ton of work. It took them hours to go over, all the things, look at our video, here's how it's going to happen. And this is after we'd already sent out a lot of broadcast messaging. But they felt that was really valuable because people still had a lot of questions. And I will say this was our lowest missed appointment rate flu clinic that we have ever in a gazillion years had.
Wow. Yay.
Yeah.
That's another plus.
Yeah,
compliance, quality, excellent. That's excellent.
It was great. And just the practicing ahead of time, we set everything up, we practiced it, it helped us film our video, it helped us see how it was going to work, it helps our patients prepare. Our nurse manager, Sheila, who's on today, practiced with like 4 different coolers to make sure that they were maintaining temperature appropriately for hours. It was a lot of work ahead of time. And then at the actual flu clinic, it was like a party. It was fun. The patients loved it. The staff loved it. And it was the easiest part of the whole thing, was actually doing it. We had, if anybody wants to know how we did it, we had the 1 tent for check-in and then 2 lanes for immunizations. We have procedures like written out exactly what to do. We had I love it. One of our nurses put together a laminated sheet with the QR codes for all the vaccine information statements in multiple languages. All the prep work just really paid off. And I think biggest surprise is that resistance just really melted away. And that was really nice. Our check-in process actually took longer. Check-in did the COVID questionnaire screening. And then at the vaccine tent, we did the flu questions. We didn't do those ahead of time. I think that's actually a brilliant idea if we can figure out how to do that. And we have all those, our flu appointments, the intake forms are customized to have all of the screening questions for flu vaccine on there. And then just check off boxes for which type it was, VFC, regular, flu mist, which kind of injectable, and then just like who did it, who gave it, and it's just all done on paper, and then we enter that later. So for our first time, we had 209 patients on a Saturday. And I look back the last 2 years at our Saturday clinics, and our numbers for flu clinic were like 50s, 60s. Our highest one was 79 patients. And we could have done an easily 50% more. So it's amazing. It took a lot more staff than what we would normally schedule for a flu clinic. But I think just ROI wise, you're vaccinating way more people. So I think it was a big win.
Ooh-wee.
That's awesome. Just a comment on the forms online and registration, you know, because you can't schedule online to PCC and all of that, you know, that's the use of full slate. But if you add Jot form to your website, they can fill out all the forms on your website and just send them in that way. And I'm sure there's other programs that do it, but we use Jot form for all of that.
Intake Queue does the same thing.
Nice. Oh, I like the, in chat, I like the music idea because it was a party.
That really is awesome. Just to catch up with some of the questions, how does the pre-scheduling software work with the PCC appointment book?
It doesn't.
No.
So it's double data entry?
Yeah, so, and you have to be careful because we limited our scheduling to the online version only, because what can happen too, if you have a schedule open on full slate and somebody's on the phone giving a patient, you know, an appointment because they see it's available, a patient could be signing up online at the same time. So you could have the faux pas of double booking and not realizing it. So we even if a patient called, we try, unless they didn't have access, we tried to, you know, basically steer them to the website, or our staff would have to remove the appointment from full slate first and then give the patient the appointment. So I just bring that up because that's a you know, sort of a hole that people can get trapped in, because we had that happen one time where the entire day, for whatever reason, didn't match up with what was in our schedule. So we had people showing up that weren't literally on the full slate. Yeah, so you have to, you know, make sure you check in PCC the schedule and compare it to the full slate, just to be sure ahead of time that you don't have any double dippers or overbooking, which for the most part is fine. You could probably fit them in, but it doesn't look good if somebody shows up and says they scheduled and like you don't have them on the list, and then it holds up the line and everything else. So
yeah, and removes all the gain that you got from the pre-work, the preparation.
Right.
That makes a lot of sense. And there was a question specifically for you, Dr. Matthieu. Did you consider doing the flu questionnaires through the portal?
We talked about so many things. I don't think we talked about that, but that I think would have been a nice idea. Well, I don't think we have quite as many patients on the portal as I would like. That really is gaining traction. with COVID. That would be a nice way of doing it.
Okay.
And encourage people to get on the portal. I like that idea.
Yeah.
We had a family come through on their bikes. Yes.
For real?
awesome. Yeah.
That is
great.
awesome encouragement.
Yeah.
Like giveaways if they show up, if they bike.
That would be a good idea.
Yeah.
The other thing is we had the front office give out the stickers ahead of time and lollipops. We use lollipops as kind of like a little distraction technique. And they really enjoyed that because they're not the ones who usually get to do that.
Yeah, we did the sugar-free lollipops too. That's what we do.
We do full sugar. I'm just extrapolating the data on sucrose in infants to kids, and I just let them suck on a lollipop, and I'm pretending the sugar is helping.
Okay. Sounds good.
All right. Okay. Just checking back. More questions. Oh no, Dr. Sachs taking his leave. Well, cool. So are any of you done with your clinics, or do you have others planned for future?
We haven't even gotten all our flu supply yet.
Yeah.
We
How many-
haven't either.
Maybe we could talk for a second. Did anybody do parents? Did you guys do any
Yes.
parents? Okay. How did that go?
It was great. The parents were required to register along with the kids, and they loved it. I mean, I had one parent try to say, I know I'm 67, but can I please get the regular flu shot? And I was like, no, we can't. You've got to get the other one.
Yeah. No,
But
we've had
they
people
were
say,
so
can you just give us 2? We'll take 2 needles. And we're like, no, it's not really
No.
this.
No, but they really loved it.
And I'm just curious, did either of you have any patient where they had trouble or they couldn't give the shot? Did you have any failures that you had to reschedule or bring back to
No.
the office? Okay.
Not at all.
We had a couple that had to just pull over and needed a little extra time, but that's no different from being in the office.
Right.
And yeah, restraint is awesome. Car seats are great.
Yeah. It's like, just bring your car seat to the visit from now on.
Yeah.
A lot more helpful.
Love a 5-point harness.
So
Yeah.
we've and I don't mean to hog up the time, but I'm just passing along little pearls. We have done this also for the second HPVs. So if you guys wanted to apply this to something else, like, if you could wait enough months from when they were in for their checkup and kind of like do a corral of the second, HPV, I think that's another, especially in COVID times, applicable use of this. And, just to tag on to that, and especially if we see a resurge with COVID, I mean, we did, car visits pretty much the same way. So when, COVID hit, I was very concerned that our vaccination rate, our compliance rate for physicals would plummet. And as we all know, we make much more money on physicals than we do on sick visits. So there was, some concern that, if this was going to go on for a long period of time, that, we wouldn't be able to potentially recapture that revenue. So we applied our drive-through, sort of workflow to doing physicals. So what we did is before they allowed you to do the well visit on, on the telemedicine, we were doing it ahead of time. We did all the pre-visit work via telemedicine, and then basically had a drive up for the brief physical. Now, clearly you had to do abbreviated, but at least they got their vaccines, so that we didn't fall behind on the usual vaccines that they get, about, those. And then we told them that if they needed a sports form and forms like that, that when things calmed down, they would need to come in for a more detailed physical. And we kept a list of who those kids are. And I think, we might see that again. If, we know that a COVID vaccine for kids is not going to be coming in December or next year probably. So we're going to have to be dealing with this for a while. So I just encourage you all to think about other ways you can use this sort of, opportunity to keep your practice, supported and support the patients and keep up on the quality scores that, a lot of us, have those. So we want to make sure that we keep those all intact because every dollar is going to count in these times.
Yeah, that makes a lot of sense. We've got some more questions as long as if you guys still have time. Our nurses are hesitant about kids under 8 because of positioning for their legs or squirmy kids. Can you talk about how easy it is for leg positioning? The asker is not a nurse or a provider, so we'd love to be able to let them know what you said about it. I want to repeat, I don't think I had, since everybody joined us, since all attendees have joined us, that this is being recorded and we will make it available for you to share with the clinicians who couldn't be here. So you don't even have to bother capturing exactly what it is. If you feel like you want to show it in the doc's own words, you can replay it for them. So any answers to that question?
I think Hiral answered it. Honestly, my staff feel it's much easier. Like, you just put your arm in front of the arms, especially the babies, like less than 3, that's pretty easy and easier than being in a room. The other kids in between, it's the outside arm facing you. So again, it really isn't that difficult. And in some scenarios, the mom might have to get into the back seat and hold the kid's other arm or hold their head. But I think the fear factor is so much decreased than getting out of the car, going in the office, the anticipation of waiting in the room. This like drive up thing is so, I think by the time they think about it, it's over already. And it's an event. It's an event. So a lot of the families will go to breakfast after, or they have some other, and they see the parent get it, or they see their sibling get it, because now it's not just one kid getting it, it's a car full. So I hear the fear, but once you do this once, they will be so comfortable. It's going to be the first one getting them over the hurdle. But as you can hear, this has not been an issue. It really hasn't. And then handling payment for parents, they give their credit card on the registration. So when they do the JOT form registration, they register like anyone else. And then in PCC, our staff would open an account for them if they haven't had it already. We don't do insurance. We don't take their insurance. We don't give them an EOB for their insurance. It's a cash, basically, business, and the credit card is charged before the visit.
We charge the parents insurance, where we are. So not a problem though for us. There's only, I think, one Blue Cross Blue Shield where they, like the HMOs, they have to go to their PCP for it, or we'll give them a self-pay rate. But we've been charging parents insurance for a while and really haven't had any issues.
Just going back to the ease of giving it in cars, that was a concern that's been brought up over the past couple of years, just safety-wise. Obviously, we want to do everything we can to prevent needle stick injuries. And I think once we were out there doing it, those concerns just went away. And there's some car seats, especially the ones that wrap around a lot. Sometimes you had to unbuckle and move them a little bit, but yeah, incredibly easy. I gave some of them, and yeah, I was impressed with how easy it was. We also used it as an opportunity to just be another touch point for patients. So we put together a flyer with, reminders about well-child checks, how we're keeping the office safe. I don't remember what else was on there. Yeah, just another touch point to, preach vaccines, well-child checks, come into the office, call anytime, kind of a thing. And I even had a QR code on that to link to a really 1-minute survey about how it went. And we had 4 patients fill it out, and they were all just, do this again. We like this.
Nice.
Oh, Julie is telling me what all we had on there. Reminder about telehealth, call us first, sign up for the portal. Thank you. That was an important one. Thanks, Julie.
Teamwork. Awesome. All right. Yeah, it looks like we've covered all of the questions. Returning to the food for thought, were there, did you guys use any particular protocols, or did you have an existing protocol you just repurposed for, or reused for this?
What? Say that again?
A protocol question. Was there anything special or anything recommended for your EHR protocol to capture all this?
No, it would be the same that you would do in the office. You know, are you sick or you have any immune? And that was really more for the parents. For the kids, the established patients, we pretty much knew all of that. And, you know, I'll also add in, you know, talking about opportunity. Also, we make sure that when we move the appointment from full Slate to the appointment, you know, for the day, that we make sure their physicals are up to date, their chronic care visits are up to date, their med checks are up to date. So it's another place to do your recall instead of just like moving names over, that you take the opportunity, as I said, to get their other visits on the schedule or give them a telehealth visit for a med check or things like that, asthma.
We have a flu vaccine protocol that has all the flu vaccines pre-selected and just check boxes for did the screening, you know, boom, boom, boom. It's pretty quick to enter everything in.
You said it was a flu shot specific protocol?
Yeah.
Did you guys do Wi-Fi in your parking lot?
We tried doing a Wi-Fi extender and had some problems, so we ended up doing a hotspot.
Yeah. Okay. Cool.
We just did everything on paper, and when we had walk-ins, we had someone just call it into the office, and they would just, you know, make sure they're a patient and just check everything and then run out an encounter form.
So Dr. Marconi, did you guys were you close enough to your Wi-Fi that it reached into your?
Yeah, our IT guy set something up, and don't ask me what it is. That's my. It's my I'm very weak in IT. I just know that they did something and it worked because our nurses were using iPads this year. This is the first year we had an IT access.
Good. And it was reliable. It worked well for you guys?
Yeah. Yeah.
Well, then maybe I'll pick their brains. See if we can recreate that for folks.
Yeah. So I don't know if they created a hotspot or whatever. I have no idea, but all I know is like it worked. So.
All right. Let's see what we get for, we hit scheduling. You guys all gave the shots per hour. And yeah, so the vaccine inventory questions, I think those are all the cold chain questions and stock. Do you guys have estimates for when you expect to get the rest of your supply or the next supply?
Not yet. They said soon.
Yeah.
It'll be before June of 2021.
You say that.
I mean, that's when they expire, so they have to give it to me before then.
How close to your the number that you'll need are you? Like, what percentage done do you think you guys, each of you, is?
I don't think we're very close to being done. We ordered, we're a small practice, so we ordered 600 private, and we've received 300. I'd say we probably have 75 left of private, but we can borrow from VFC if we need to. in Georgia.
Yeah.
I haven't looked at what that entails and how much paperwork and firstborn child's blood I'll need, but we'll see.
So there's a tip. Stock up on your firstborn's blood.
Yeah.
Yeah.
Right.
Aye, aye.
Well, and this year, we were told that for our private injectable, they're not going to be giving us our allotment in 1 or 2 pieces. It's going to be smaller pieces at a time. So, I mean, we have more flu clinics scheduled, and it is just a guessing game when it's going to come. I don't know. It's
So
We had to push our first flu clinic back because we didn't think we'd get it in time.
geez, how far back did you have to push it?
We pushed it back 2 more weeks.
Ugh.
we had to cancel our first one because of the wildfire smoke. The air quality
Oh,
is so hazardous.
How are
Ugh.
things going there now, Dr. Matthieu?
Well, in Portland, it's great. We might get a little whiff every now and then. Don't know that it's going great closer to the fires, but
Yeah, I'm glad things are.
everybody that works here is at least back in their homes, so that's nice.
I'm glad. Good. So we've got a question near and dear to my heart in the chat. Is anyone doing drive-through during cold months? Has anyone ever done that?
we're
And
in Georgia. There's no such thing.
Georgia.
We get rain though.
I mean, we did drive-through sick visits in March, which is not terribly warm for anything respiratory. Like our staff went out to the car and they didn't mind doing it. I don't know what will happen in January and February when it's really cold.
Mm.
Some people are using tents. And I heard some talk of like you can rent a tent with a propane heater, but honestly, I think you have to get a permit for that to be able to do that in like a public space. So I don't know the details of that, and I definitely would be worried with that kind of situation. But there was a practice who reached out to me, and they one of their doctors, believe it or not, has an RV, and they use that.
Oh,
And
wow.
they had like, you know, like, so they have running water, and, you know, so that's another really cool idea that I guess if, you know, the winter comes and it's tough, you know, it's still a closed space, but I guess it's better than bringing people into the office, you know, if we feel that they need the super duper PPE. But I thought that was a cool kind of adaptation.
That would at least have wind protection and
Right, exactly. Yeah,
That's awesome.
yeah. And has heat or air conditioning and running water.
Yeah.
We're in Oregon, so we have tents for rain, and it rained a little bit for our first clinic, and it was a welcome relief because we were kind of hot in our gowns. We'll see if it gets pretty blustery. I don't know how we're gonna.
Yeah, and I think too, I had a couple, I worked with a practice who was in a city, and they don't have like, you know, there is no drive up thing. So we were able to kind of, we called it a pop-up clinic, and basically they were able to use part of their lobby. So people would just kind of like run in and run out, and a similar station setup, you know, a check-in person and, you know, a shot giver with a screen. They used a screen, you know, one of those portable screens, and they sort of did a pop-up in the lobby. So they didn't have to go in the elevator and all that kind of stuff. So it was another adaptation of sort of drive-through, but not really drive-through, walk-through, I guess you could call it. But it alleviated them having to use up, you know, exam rooms and, you know, table paper and all that other kind of stuff that you have to do in cleaning the rooms. So, and they just had one last week, and they said it went really well.
Nice. I like that idea. Well, good. So are there any challenges or things that you guys were able to sidestep that you haven't mentioned? Or anything that you couldn't overcome? Anything you had to forfeit? or that you do differently next time?
One of the
I get a really long extension cord.
For real.
A couple of our computers died, but we had so many backup laptops because we all work on laptops that wasn't a problem, but definitely a very, very long extension cord.
One thing that we found that we're changing for the next one is we had, a table at our vaccine tent, and just the bending over was a lot. Bending over, reaching into cars, bending over, to draw up and do supplies and stuff. So we've ordered a couple smaller tables that elevate to more counter height, just to be a little more body friendly.
That's a great idea.
Yeah, some of us, in some decades of age, were hurting quite a bit.
Yeah. Well, yeah, the contortions you must have had to do to reach and restrain. So you're using, you need a pretty solid core to be doing that bent over. All right. Well, please do interrupt me if you do think of other things that you wish you had thought of. What we're going to do with the bit of time that we have left, like I said, this hour goes so fast. Can you believe 45 minutes have gone by already? What we want to do in addition to, or beyond today, is to get feedback from folks. And here I am going to add the recommendation for mental health roundtable for future roundtable topics. So this will give me an opportunity to prepare folks also. What I've been doing is depending upon the CAs to nominate people, to nominate panelists for these roundtables. Nobody knows you, nobody at PCC knows you guys like your CA knows you. So we've been depending on them to say, we're depending on you guys to tell us which topics you want covered and which ones are of the greatest benefit to you. And then depending on CAs to nominate clinics and practices that are doing those things really well. So what I hope to do is, for the folks that are in attendance today, including our fine panelists, of the things that you see here before we hang up today, if you wouldn't mind typing into the chat in order of your preference, the letter of the thing that you want to see next. And I probably left flu clinic in there, so we can take that one out just for now. But if you wouldn't mind, like I said, if you would look over this list and just try to give me a sense of which things you would want to see, and you can email them to me as well if you want. You want to grab a screen cap and you don't want your vote. If you want your vote to be anonymous, I understand entirely. It is election season after all. And let me make sure there's not something under S. Yeah, I didn't want to be missing a page break there. So the things that are here, if you're on the phone and it's difficult for you to see the list, the options are mental health, back to school. We kind of missed that vote, so that's probably going to get a few votes at this point. But in order of preference, if you'll put the letter A is mental health, C is back to school, D is choosing COVID testing kits, E is labs in general, and that we have done a workflow one, so E for labs. We've done workflow before, but any workflow that you guys want to compare notes on or see how other practices are doing it, workflow in general is something that we know we want to revisit. So E for labs, F for referrals. So again, probably workflow related, but even materials and tools that you use for tracking referrals. G, letter G is charge posting. Letter H is patient portal. Letter I is patient outreach and patient recall. Letter J is broadcast messaging. Letter K, single texting and safety and in-person services. That's all one topic, single texting and safety and in-person services. Care plans is letter L. Letter M, like Michael, is ERX. Letter N, as in Nancy, E-Labs. Letter O is immunization registries. Letter P, please pardon my abbreviations here. Letter P is DSM, direct secure messaging. So that's the secure communication and record sharing between practices. Letter Q is PCMH, letter R is credit card on file, and letter S is other. So that's your opportunity to suggest to me something that you'd like to pick other practices' brains about. So A through S, if you would, before you hang up, just pop your preferences for that into chat. I will take those under advisement. You can also email them to me at jan@pcc.com. But otherwise, I will clean up this recording. I will make better sense of the notes that I gathered here. Dr. Matthieu was very, very generous with sharing the resources that she used, a lot of the handouts and documents. I will confer with you about the things that are okay to share, and I will make those, we'll put those in a spot that is easy for folks to reference. And other than that, I think everything that I had in mind to discuss has been covered. If folks have questions that you want to put in the chat, we've got just a few more minutes, but otherwise, those can be emailed as well, and we'll see if we can't get an answer to those. And any final words from our fine panelists?
Thank you. This was very helpful, I think.
Oh, good. Thank you for being a part of it, all three of you. I really am super grateful. Stealing is totally cool. That's pretty much what we put these events together for, because you all are stealable. Your ideas are really, really awesome ones. So thank you for sharing them. Thank you for agreeing to be part of this, and stay tuned. Because this was a register event, I've got emails for everybody that in order to use to follow up and send out materials and follow up messages and to hassle people about what you want to see next. So I'm going to endeavor to do these once a month, if not more often. And again, I think I said early on, lesson learned, the timely ones, I'm going to try and schedule those a ways out and get people's participation lined up long in advance, so we don't have another, hey, you want to meet me next Wednesday scenario. But these people were kind enough to meet me next Wednesday. Today's next Wednesday. I really, again, I'm very, very grateful, and I hope this was helpful. I hope to see you all at the next one.
Thank you.
Bye, everybody.